You serve on the Healthcare Committee where your goals are to reduce costs and harness innovation. What's going on in these areas?
Well, there's some really fascinating bills that are moving through the process. Of course, we continue to grapple with implementing the Affordable Care Act, and I think Washington's health benefit exchange has operated better than most states, but we still have challenges. But one bill that I have prime sponsored, it's House Bill 2565. It would, I think, offer a lot of promise about it's an innovative way to try to improve quality of care, improve health outcomes, and reduce cost. And it does that by providing incentives for both physicians and their patients to follow best practices and follow through with healthy behaviors such as smoking cessation, weight loss, exercise. And this model actually has been, the state of Oklahoma has adopted this model and they're conducting a 3-year pilot project that began last month to test the efficacy of this approach. Projections are that the state of Oklahoma will possibly realize anywhere from $60 to $70 million of savings per year in its employee benefit health plan. And so I thought, what a better way to see if this works in Washington than to sponsor this bill. It was voted out of the Healthcare Committee today. Also, the state of Michigan has adopted this approach for its Medicaid population, and as a pilot as well, to see if using incentives and rewards can actually lead to better decision making by people and their physicians, which would also reduce hospitalizations. Because I think if you make healthier decisions on the front end, and you also are working closely with your physician to have healthier outcomes and following your doctor's advice, that will lead to reduced hospitalizations, which is where we really see the significant savings. Several hospitals have adopted this mutual accountability model. For instance, Lourdes Hospital in Washington State, which is in the Tri-Cities area, adopted this approach with its employee benefits plan, and saw a drastic reduction in inpatient hospitalizations. So right now we're just at the testing phase. I hope that this bill, House Bill 2565, can make it through the process this session. There's lots of support from both sides of the aisle, so I'll look forward to updating the folks back home on the progress as we go through session.
There was a hearing on a measure that would offer appeals for involuntary commitments when dealing with a person with mental health issues. Can you tell viewers a little about that bill and the debate?
This is actually came to us from a real tragic situation that occurred last year in Seattle, where back in July of last year, a young man who was 30, who was undergoing a severe episode of schizophrenia, was actually killed by the Seattle police because this man was out on his balcony in an apartment in Seattle with a gun, thinking that zombies were coming after him. And so because of that action, he was killed by the Seattle police. And tragically, for the previous 6 months, his family and friends, his parents actually resided out of state, but he had lots of coworkers and friends who could see him slipping into his psychosis. And one of the things that I've learned through this bill and my research is that when you're undergoing a psychotic episode or slipping into a schizophrenia episode, that individual loses the ability to recognize that they're ill, and they think everyone else is the ones that are ill. Everyone else is out to do them harm, so to speak. So his parents and his friends could see him slipping into his illness, and they made repeated inquiries and repeated contacts with the county's designated mental health provider. Under Washington law, only a designated mental health provider has the authority to petition a court for an involuntary commitment for mental health treatment. Other states are not so restrictive. In fact, the bill that I've co-sponsored is modeled after Arizona's legislation that affords parents and close family members the ability to petition a court for an involuntary commitment order to get someone the help that they desperately need. So, unfortunately, I mean, tragically, the family's pleas and the friends' pleas went unanswered, and this individual was not given the treatment that this person needed because only the designated mental health provider could make that determination, and under Washington law, the standard is so high that when his parents went to the designated mental health provider to ask what could be done, they were basically told, well, our standard in Washington State requires him to have essentially a loaded gun to his head before we can petition the court for involuntary commitment. And I find that completely outrageous, completely unacceptable. We need to do more for our citizens who suffer from mental illness and mental disability. We are warehousing our mentally ill in hospitals throughout the state, which is, I think, unacceptable. I think everyone would agree with that. We don't have enough beds in Eastern State and Western State Hospital, but this is a real public health crisis that I think we need to address this session. This bill is just one tool that will give family members the ability to, again, go to that court. The judge still has oversight because we are talking about civil liberties and infringing on someone's liberties involuntarily, but that judge still has the oversight. That judge can deny the petition if there's insufficient evidence, but I think the current system is broken, and we also need to fund our mental health treatment system much better in Washington State. So we're going to address that piece as well as we go forward in this process.